tension applied. Alright? I cannot use the hybrid Hyrex in a mixed addition, okay? If there is no expansion applied for that reason, right? So what should I use? Okay, then I ask ChatGPT. How many of you use ChatGPT? Raise your hand. Yeah, you use it for what? Taking exam? I mean, this is just kidding. Alright? So here is Cambry, alright? 8 years old. 7, 11, alright? So now, by the way, the green line is Dr. Larry Andrews' aesthetic line, alright? If the upper incisors did not touch that green line, look at this. The upper incisors is way behind that line. So what does that mean? She's ugly. You're supposed to laugh, okay? She's ugly. Right, you're supposed to laugh, okay? Yeah, it was a joke, okay? So, she has maxillary deficiency, all right? Okay, now if you take a look at the bite, just anterior cross bite, all right? So what's the second thing that you should check? What's the second thing? Oh, you are wearing this, okay? I'm going to ask somebody who did not wear one of this, okay? What is the second thing? That's right. You check for COCR discrepancy, right? Okay? So, but that's... And also, if you do an intraoral scan, all right? Then you can check if the width in the anterior and the posterior match or not. That means intermolar and intercanine. You gotta check both. Because sometimes intercanine width is narrow, sometimes intermolar width is narrow. Okay? So this particular patient, intermolar is okay. But intercanine is a little bit deficient. That's why. Okay? There is crowding on the upper arch. Okay? So Panorex OPG said no problem. Alright? So here's the diagnosis. By the way, is this a dental class 3 or is it a skeletal class 3? Let's see who is not wearing one. Ha ha, you are not wearing it. Ha ha. Is it a dental class 3 or is it skeletal class 3? Dental. Everyone agree? It's a dental class 3, right? So, how are you going to treat this? Patient said, I don't want expansion of bite. So, how are you going to treat this patient? Any suggestion? Huh? Are you going to use brackets or no brackets? No brackets. So, you're going to use clear aligners? No. So she just want to have a bite plane and tip the upper incisors forward, right? You can do that. Anybody who want to use aligners to treat this case, raise your hand. Oh, have you ever done that? You have done that. Is it successful? Now you guys better go to this guy over here, all right? So he has used, I'm going to show it to you how I did it, all right? So, yeah, I have a bite plane, all right? But that's not to jump the anterior cross, all right? Because I'm going to be using clear aligners, all right? So here is the click check, okay? I want you guys to see the increase in width, all right? So let me see if I go back. Okay, and maybe I cannot go back. Okay, now here we go again, all right? Now take a look at you see the increase in the width, all right? So altogether, it's 16 aligners, okay? So you jump the anterior cross bite, all right? And you also basically correct the width, okay? So, here is conically aligner number 3, and I added on a face mask, which is kind of cool, okay? Because this particular company has button, they call it angel button or angel hook. You can put it in there for nighttime connecting to the face mask, and then daytime class-3 elastics. Oh, isn't it cool? You know, just add a few buttons in there. You can try it, right? So does it work? Check it out. Okay, so nighttime and then daytime elastic. So 7 weeks, okay, now each aligner just 1 week, all right? You don't need to go 10 days or 2 weeks, just 1 week, all right? So 10 aligners, all right, that's how she looks like, all right? 10 weeks, you already jumped the anterior crossbite, you know, in 10 weeks, all right? So you check the occlusion, all right? Okay, now let's go back a little bit first, okay? So the question is, how many millimeters did I get for expansion? Interesting, all right? So hold that thought, okay? So my question to you, especially, by the way, who are the students here? Raise your hand. Who are the orthodontic students? All right, there are 2. There are only 2. Is anybody over here a resident, orthodontic resident? All right. Okay, the resident. How many millimeters, if you want to do some research, how many millimeters do you think we can get expansion out of clear aligners? How many? Well, I mean, you are too smart, you know, you already asked a different question. And obviously, I only have the model, so it's a combination of skeletal and dental expansion, right? So how many millimeters? Give me a number. 6? Oh, see, these students are smart. 6 millimeters, that's not too bad, right? Now, before I tell you the result, okay, I want to give you another patient because I mean, there's no way that you treat one patient and you said that, oh yeah, it works, right? So, and then the last one is, you said is dental, class 3, right? Take a look at this, okay, patient. Now, Patricia, okay, she has also anterior crossbite, posterior crossbite, but she also has another problem. So, what's the problem? Missing teeth. How many teeth are missing? 2 lateral incisors. Is there anything missing? Why is the lower first molar fully erupted and the upper molar? 2 upper molar and 2 upper lateral incisors. Alright? Okay, so I think I have to show you some numbers because just to convince you that this is not a dental class 3, okay? This is sort of like a skeletal class 3 for that because of the width, because of the A and B. Alright? So now, here is the problems. So the strategy, yeah, so I'm going to use the same thing. Right, clear aligners because the patient doesn't want expansion of aligners. It's just the hygiene is not so good. All right. So and we're going to do the same thing now. Watch how much expansion. Okay, the student back there. Okay, watch and tell me if you hold the whole one is 6 millimeters. Now, so you are going to do arch development. Okay, to make space for the lateral incisors. All right. So, I mean, you are pulling the clear aligners with 16 ounces of force on each side. Okay. So the question is, how are you going to make sure that there is enough retention of that appliance? So obviously, there are 2 things you can do. One is to increase the trim line. All right, you understand what the trim line is? How much it covers all the way to the gingiva. All right, so don't stop at the gingival margin. Okay, go further up. Okay, so you get some because we are going to do protraction and also class 3 elastic during the daytime. So this is Patricia, okay? So it takes 23 alignments, okay? So we jump the anterior crossbite, we open up the space for lateral incisors, and the posterior teeth obviously need a little bit of settling for that reason, alright? Now, I only have 60 minutes left, because I'm supposed to talk about THÄTs or mini screw like Dr. Wim, right? I have to, because otherwise this conference is about mini screws, right? So, for patients who are in permanent dentition, so let's say you miss the golden period, which is 7, 11, right? You missed that, right? And you have the sutures that you need to go against, which is the zygomatic buttress, the cheekbone, okay? Alright? The pterygoid plates back there, and also the nose area, which we call piriform. Okay? So those are the areas that I'm going to start talking about the MOD-P appliance, so Dr. Wims will continue this afternoon for that. Alright? So, by the way, 2025, there is a consensus. Go out to 26 experts in orthopedics, and they all agree. If you want more efficient orthopedic treatment, it would be best to do it with THÄTs. Right, Dr. Wims? You agree? Yes. Okay? So that is if you want the sign. Okay? So you can do that. Alright? Now, I'm going to move on. So I'm going to show you one last patient. Now, 13-year-old boy, right? It already passed the golden time, 7-11. Early permanent dentition. Alright? So, again, he doesn't look very good because his upper incisors is behind the green line, right? So you need to move it forward for that reason, at least for the aesthetic part of it, right? But this is how his bite is like. Now, if you take a look at the upper arch, there is no space for the canine, correct? Look, you got the first bicuspid right next to the lateral incisor, all right? So you have severe crowding in the upper arch, and you got the anterior crossbite. So let me ask the student in the back there. Okay, sorry, I will keep bothering you. Extract or not to extract? So she shake her head. When are you going to make that decision? Extract or not to extract? Until when? So 13 years old. It's a boy. It's a boy. 18 years old, you will make that decision. Are you kidding me? So you're going to have him wait 5 years? Because you have growth to consider, right? It's gastric. That's number one. Number two is your width is not done yet, right? The width, you don't know how much space. Because every millimeter you expand, you can get 0.7 millimeter of space, okay? But you have to expand a lot because he's got 8 millimeters deficient just on one side, all right? So it's a tricky situation, all right? And of course, so if you cannot use conventional expansion appliance because he's already past 7-11 for that reason, all right? So, what are you going to do, okay? There's no teeth missing, all right? But take a look at the third molars at the back. I mean, this is fighting the second and third molar. They're fighting to come in. It's kind of like you are the mother, you're pregnant, there's a pair of twins. Who's going to come out first? By the way, that's a joke, okay? You're supposed to laugh, okay? There's a pregnant mother, there's a pair of twins. Who's going to come out first? depending on whether the baby is Asian or not, right? Or Vietnamese or not for that, because you guys are a little more courteous, okay, for that reason, okay? Alright, so you did your saprometric analysis. It does have some skeletal problem, okay? And now, the reason I want to show you this case is not its perfect case, alright? There is a problem there. Okay, take a look at the design of this appliance. First of all, I use the roller band, which is good. It reinforces the molar ending, okay, so it won't break. But I'm supposed to extend it to the canine area, right? But I extend it on the palatal side because the upper canines are erupted on the outside. But biomechanically, that will be below the center of resistance. So you're going to have some bite opening. So this is a MAPI appliance, okay? And you're going to be putting 4 screws in there for bony anchorage support, right? So we're going to go ahead and expand, okay? And you can see some tissue reaction to the MSC appliance for that reason, alright? So, but don't worry, okay, because there are people who are allergic to nickel for that reason. So we're going to go ahead and expand, alright? And you're going to see the students over there, if there is enough room for accommodating the 2 canines and so the premolar at the back there, okay? So it turns out, okay, that we were successful, all right, as far as getting enough space for, and but you can see the difference in the arch form, the upper arch and the lower arch, all right? So in this case, we are lucky that we don't need to take out any teeth, okay, and the teeth basically looks parallel, and also his upper incisors right now is closer to the green line, so it actually looks better for that reason, all right? Now, I only have about 21 seconds left, okay? Is it 10 minutes or is it, do I have 10 minutes? Okay. All right, so one last question. What if your patient does not want to wear the face mask? See? You understand English, okay? What if the patient does not want to wear the face mask? And this little boy also has maxillary deficiency, right? Both the width and the anteroposterior. What would you do? Are you going to use clear aligners? Well, he's 12 years old. He's past what? 7, 11. So that's not good, okay? Clear alignment is not good. So what are you going to do? You're going to refer to your friend. The functional appliance, what do you call it? FR3 or what kind of functional appliance?
Bạn có nói đến đó là cái functional, cái
hàm
chức năng cho loại 2 hay là loại 3?
Activator.
Bạn nói đến hàm activator. Và sau đó thì là tiếp đến là khi
okay. Are there any other suggestions? Well, by the way, you need to protract the maxilla forward, and the patient doesn't want a face mask. So what do you do? All right. Maybe look at the upper arch; it's so narrow in the intercanine area. All right. The lower arch is very oval, right? And then there is one more problem. Right? Not about how the teeth fit, but it would be nice if you have a few more teeth. Right? If you want to protract the maxilla, you gotta have teeth for that reason, right? So you don't have enough teeth and you don't want to wear the face mask. It's a problem, okay? So, what are we going to do? Lord, you're going to take X-ray. Whoa, the width is minus 13. Is it minus 13 the width? By the way, The normal width is
cái chỉ số width bình thường là
0 or -1, right? So is it good, bad, or is it ugly?
Vậy thì bạn thấy là với lại cái kết quả trên phim như thế này thì
Good,
cái tiên lượng như thế nào?
bad, or is it ugly?
Tốt, xấu hay là quá là tệ? Ugly.
See, I think I lost. Okay. Bad means that you can camouflage
Nếu mà
by orthodontic
thì có
movement.
nghĩa là tôi có thể là
Ugly means that you're gonna need
cái
surgery.
chỉnh răng được.
Is it good, bad, or is it ugly?
Như vậy là tốt, xấu hay là quá tệ?
Do you think it's ugly? You think it's ugly? Anybody think that it is good? Raise your hand.
Nếu như ai
Yeah,
nói rằng
hopefully
cái này
it's
tốt
not
thì
the
hãy
student right
hãy
there.
giơ tay ạ.
Okay? Now, by the way, the student, is it good, bad, or is it ugly?
Sinh viên ạ.
It's kind of
Cái này
ugly,
cái
right?
tiên lượng như thế nào?
Okay, so here's the diagnosis, okay? Oligodontia, alright? And class 3 skeletal bone, naturally deficient in congenital missing teeth. So here is some option. By the way, this is not strategy. These are option, alright? Surgery first, right? Because it's class 3. The second thing is maxillary expansion with MAPI with face mask, but patient decline face mask, so that's no good. Alright? And the bullet plates.
Cái tiếp nữa đó là chúng ta dùng cái plate.
Okay, with class 3 last stage we call it the band. Alright? By the way, you guys heard of Hugo the Cluck?
Chúng ta đã nói
Anybody heard of Hugo the Cluck? Raise your hand.
Đã ai nghe tới Hugo Cluck
Well,
chưa? Tác giả Hugo
he's the
Cluck
one
chưa?
who talked about the bullet plates.
Chính
Alright?
là cái tác giả mà
But
đã
the
nói
problem
về
is the plates has to be in the lower area, and it's very, very traumatic. Okay, to put a plate on the upper, put a plate on the lower. Right. Then final thing is microimplant assisted maxillary retraction.
với sự hỗ trợ của Minivit là MAPI.
So you
Và
can
chúng ta kéo cái hàm trên ra trước, nó gọi là
maybe
MAP.
do class 3 elastics full time
Vậy thì
instead
liệu
of
là
a
chúng ta
face
có cho
mask.
bệnh nhân đeo
But you gotta have a bony plate on the upper. You gotta have a bony plate on the lower. Alright?
và nếu như
So,
khi mà chúng ta muốn cho bệnh nhân
what
đeo
are the
chúng ta-
options that you
thì chúng
can
ta
do?
bắt buộc sẽ phải plate ở hàm trên và plate ở hàm dưới để cho bệnh nhân
Well,
đeo
you
chung
can do something like that.
ngày.
Alright? So basically, this patient have edentulous area.
Và chúng ta thấy
So
là
you can
bệnh nhân này có
actually
cái
put
khuôn
a
mặt
few mini
yếu
screws
răng.
on the
Chính vì thế
lower,
mà tôi
and
phải-
you also
Chính vì thế mà tôi phải
can
đặt
put
cái
some sort of a MAPI appliance
phải
on the
đặt
upper,
cái
but
Minivit ở trên và
the
ở dưới
patient only wear class 3 elastics
để cho bệnh nhân đeo
and
cái
24
chuỗi.
hours.
Và bệnh nhân
Alright?
phải đeo 24
It would not work, okay, if the patient only want to wear it about 12 hours,
Nếu như mà bệnh
14
nhân chỉ
hours,
muốn đeo
because you don't have the
dài
face
kỳ
mask.
mà lại chúng ta lại không có
Alright?
face mask.
But you'll be amazed. You actually don't need 16 ounce of force because those are called heavy intermittent force. Right? So patients wear the face mask at night for about 12 hours, 10 hours, and 16 ounces on each side. But you can offer the patient alternative. Alright? You wear it for 24 hours and you don't need to wear the face mask. Alright? So that's what we offer for this patient. So those are the plates that you put down in the edentulous area. Alright? So you're going to protract. So we reduce it from minus 13 to about minus 6.5. And then you basically put prosthetic, teeth until the patient's finished growth, because the patient is only like about 14, 15 years old. And then you can put on prosthesis to replace it. Alright? So you can see. I mean, the reason I want to show you this is there are orthopedic effects with just elastic. Very interesting, alright? So that would be probably one option you can do. But you can also see this particular boy, look at that. He's got growth during the treatment. So if you don't have anything orthopedic in there or have orthopedic in nature, you're not going to make it.
Và
All
như vậy
right?
thì chúng ta thấy là
So,
bệnh nhân này còn đang tăng trưởng trên
the final slide I want to show you is there is always the dark side about using mini screws, right? It's not like it's totally problem-free, alright? And you definitely have some information, you got tooth discoloration, you can have appliance break, asymmetric expansion, alright? How do orthodontists take care of asymmetric expansion? You camouflage it with orthodontic tooth movement. But inside, when you do expansion, they are not always. About 60%, okay, is symmetric, about 40% asymmetric. So we still consider that to be kind of like a side effect. So if you read a little bit about it, be my guest, okay? So I'm going to conclude my lecture because I answered 3 questions. The golden time for doing maxillary protraction, if the patient wear the face mask, 7-11, all right? If the patient doesn't want an expansion appliance, you can choose. Now, 7-11, I'm not talking about a 13-year-old, okay? You can choose to have clear aligners with the buttons already, and also design your appliance to have maximum retention while the patient is wearing it. That means you still have to put attachment in the primary molars, okay? Remember, if mixed dentition, you put attachment on the primary molars, you have to etch longer, okay? Etch longer, otherwise they will stick, all right? And then the final question I answer is, what if you miss, okay, the golden age of 7-11, then obviously you're going to stick with the MAPI appliance. So in general, in my clinic, any young patients above 11 or 12 years old, I will go ahead and put MAPI, even just for expansion, right? Because if you think about it, okay, if it is your children, would you want the upper molars to tip out? Right? Because every time you tip it out and it's upright, you're going to lose buccal bone. Right? You compromise the periodontal situation. So if you're not going to do it for yourself or your children, your own children, don't do it for other patients. Okay? And it's not so scary because Dr. Wynn's going to show you putting MAPI appliance in patient is a piece of cake. You just have to get over that hump, okay? Then you'll be a lot more successful because your expansion is going to be more stable. Okay, thank you everybody for your kind attention.